My name is Jaquelina Rousselot with EliteHealth Medical and Wellness Center. And today we're going to talk about home services. I noticed that one of the main concerns, especially during COVID-19, is how we protect and who take care of our loved ones, our family at home. In order to help us to understand a little bit more about home services, I have the pleasure to introduce the owner of Reid at Home Miami. How are you doing, Reid?
I'm doing well. How are you doing?
Doing great. Thank you so much for being here.
Yeah, thanks for having me.
And like I said before, it's one of our main concern about what to do. Especially, let me tell you, I have my mom. I'm concerned what happened with my mom while she's at home.
Sure.
And so what is Reid at Home Miami?
Yeah, so Reid at Home Miami. So Reid at Home was established in 1995 in Omaha, Nebraska. So we are a franchise. So Miami, we're the only location in Miami-Dade County. But take Broward County, for instance, there's probably 3 or 4 locations.
Oh, okay.
So we offer anything from companionship for seniors to personal care services, which consist of ambulatory work, assisting seniors getting out of bed, bathing, toileting, helping them get around the house. We call it activities of daily living, which is necessary functions during the day. And then we have other functions like going on walks and getting groceries for seniors and just other things to do in the course of a week.
So basically it's what our parents, our grandparents need when they are alone at home. And so in order to be or receive those services from you, there are special qualifications or requirements?
Not at all. So you don't need a doctor's note. You really our process is extremely efficient.
Mm-hmm.
So typically what happens is, and it's most of the time, where a child of the senior who has historically been the caregiver for the senior just can't do it anymore. They don't live locally. And they are asking for us to help the family. And typically what happens is we have an introductory phone call.
Okay.
We go into the house and conduct an assessment and develop a custom care plan. So then we can match a caregiver to the personality and the preferences of the senior.
Oh, that's great.
Yeah.
And another concern, and I'm talking a little bit about me as well as an experience having my mom alone at home, is who is taking care of my mom?
Of course.
Who is taking care of our loved ones? So tell a little bit about your staff.
Yeah, absolutely. So our caregivers are all level 2 background checked through the state of Florida. They're screened, of course, by us. So just because they pass a background check doesn't mean they're good enough to work for Reid at Home. So we go through a screening process. We have an introductory phone call. We get them into our office so we can meet them. We can chat with them. And if they keep passing each step, they go through an orientation. So they're getting trained by us in the office. So we're not depending on another home care agency training them. It's our training. And Reid at Home as an organization, nationally and internationally, has put together a training regimen for these caregivers that really works. So it's proven. So.
That's great. And when it's coming all of these good news and good services that you provide, one of the questions that is coming is who pays for that?
Yeah, of course. So payment it's a tough subject in this industry because although things are changing slowly, but I think surely, historically it's been out-of-pocket private pay. But if, for example, if you're a veteran, VA will cover it. We're part of 2 networks with the VA. And we have a third-party partner that helps with certain benefits with the VA because there is paperwork involved. But luckily, we have a partnership with a local company that will help you through that process. So another way to pay is through workers' comp. So if somebody gets injured on the job, we have a partner who is kind of a middleman between workers' comp providers and us, and they help us with that reimbursement. But yeah, typically it is private pay. And one thing I didn't mention as well is long-term care insurance. So I'd say half of our clients have long-term care insurance. So that typically pays for all of our services up to a certain limit. So, I mean, we've had one client who's been paying via long-term care insurance for 3 years. So,
oh, wow. And you know what, in EliteHealth, we have a patient that they are VA, they have long-term care.
Yeah.
So the good things to know is that you don't have to pay out of your pocket. You can supplement
Exactly.
or combine all the benefit that
we,
you have.
And the important thing is we help you through that process. So it's
Okay.
not you and your family dealing with it, because there's a lot of paperwork and administrative hassle. So we're very familiar with long-term care plans or long-term care insurance plans. And then, like I said, we have partners for the VA and workers' comp. So
excellent. And what areas you cover?
So we're all of Miami-Dade County. So
Miami.
technically our territories are on the eastern side of Miami-Dade County, but we because there's no right at home in Miami-Dade, we can service the whole county.
Oh, that is great.
All the way down to Homestead.
So in that case, when I have a patient or someone that is coming to me with that concern about home services, the first thing to do is call you. And where we call? How we can contact
Exactly. So our number is 305-697-9722. I or a member of our staff will be at the other end of the phone. So yeah, it's like I said, it's a pretty easy process. You just call in. We have an introductory phone call, and I mean, we can start services the next day many times. So it's very easy.
And one thing, Reid, I'm sorry, because I have a question for one of our patients. There is any limitation? That is another concern. Limitation of hours, days required for your services?
There's no limitation on hours or days. We have tiered pricing. So the more hours you do with us, the lower the cost is on an hourly basis.
Oh, that's great.
So we work with our clients, and a lot of times they start out at low hours. So they're paying more. It's more expensive on an hourly basis at first, and then they need our services more and more. So they do more hours with us, and then it gets cheaper for them on an hourly basis.
So you have a kind of financial plan.
Yeah, exactly.
That adjusts to.
And again, we work with families on the financial part of it.
That's great, and thank you so much.
Yeah.
Because it made clear what is home services, home care, and again, Elite Medical Center. We are here for you. We are all about you. So call us back. My name is Jaquelina. My phone number is 786-583-5411. Thank you.